Welcome viewers, you're now watching Hornbill TV. A fresh global health alert has been put countries across the world on high surveillance after a rapidly spreading Ebola outbreak in Central Africa triggered international concern. The outbreak linked to the rare Bundibugyo strain of the Ebola virus has already claimed more than 130 lives across the Democratic Republic of Congo and Uganda, prompting the World Health Organization to declare it as a public emergency health of international concern. In India, authorities have intensified precautionary measures at airports, especially at Delhi's Indira Gandhi International Airport, where advisories have now been issued for passengers arriving from or transiting through high-risk African nations. Health officials say there are currently no confirmed Ebola cases in India, but surveillance, screening, quarantines, preparedness and lab response systems have all been placed on alert. Meanwhile, the growing crisis is also beginning to impact international events, with DR Congo reportedly cancelling its FIFA World Cup 2026 preparations camp due to the outbreak. The world is once again on high alert as Ebola cases continue to rise in parts of Central Africa. The latest outbreak caused by the rare Bundibugyo strain of the Ebola virus has spread across several regions of the Democratic Republic of Congo and into neighboring Uganda, raising fear of wider cross-border transmission. According to the World Health Organization, nearly 600 suspected cases and around 139 suspected deaths have been reported, with authorities warning that actual number could be significantly higher due to delayed detection and also underreporting in remote conflict-hit areas. Health experts say the outbreak is likely to circulate undetected for nearly 2 months before confirmation, following the virus to spread through densely populated zones in eastern Congo, including Ituri and North Kivu provinces. Cases have also been confirmed in Uganda's capital, Kampala, after infected travelers crossed the border from Congo. Here is a visual from the ground zero. As you can see, the condition there is quite unfortunate and disturbing. Millions, especially 40,000 children, are in labor camps and cobalt mines around the country. The World Health Organization has officially classified the outbreak as a public health emergency of international concern, citing the speed of transmission, rising deaths, cross-border movement, and the lack of an approved vaccine specifically targeting the Bundibugyo strain. The outbreak has now begun affecting international sporting and travel activities as well. Reports also indicate that DR Congo cancelled its FIFA World Cup 2026 preparation, the camp amid concerns over the spread of the virus and international travel restrictions. Global health agencies including World Health Organization and the US CDC have meanwhile intensified emergency response operations, contact tracing and also treatment center deployment in affected regions. However, officials warned that the vaccine development for the Bundibugyo strain could still take several months. WHO currently assesses the risk of global spread as low but says that the risk remains high at regional and national levels within Central Africa due to porous borders, healthcare limitations and also not forgetting the population movement. WHO has opposed the US Ebola travel ban, saying that the virus is not airborne and spreads only through direct contact with bodily fluids. Instead of restrictions, it recommends contact tracing and screening measures.
I'm wondering if you could comment on the decision by the US to impose a travel ban on Uganda, DRC and South Sudan, and whether you have any advice or recommendations for countries with more direct travel links to those countries on whether that would be an appropriate public health measure to take. Thank you.
Thank you, Rory. Dr. Mahmoud, would you like to start?
Thanks for that question. Well, WHO recommendation for a long time is evidence and science-based and solidarity. For some time, we know what works. What works is contact tracing, monitoring those contacts, isolation, and immediate referral. Give you an example, like Uganda has done an incredible amount of work in tracing all the contacts and putting them in an institution or home quarantine and monitoring them. So we encourage all contacts, and our recommendation, we'll hear from the emergency committee what the recommendations are. All contacts, all cases should not travel. So we would like to all countries and appreciate what they have done so far. That's the first step of defense in terms of a global health security. Second element, countries are doing point of exit screening. Both Uganda, DRC are already doing that. So in support of the activity done by Uganda and DRC and going in this humanitarian conflict area, supporting them is the best medicine for the entire world in support of solidarity of DRC. It's a complex, as DG said, hundreds of thousands displaced population, insecurity, travel restrictions. Countries have sovereign, they do their own risk assessment, but they do have to provide to us the justification and the rationale behind their mandates. And we are seeing more and more countries. But currently, our top priority is to work closely with DRC in ensuring all the contacts are traced and all the patients suspected are put in the clinical pathway in safe environment and with the best care provided.
Thank you very much. Looking if anyone else would like to add something. If not, we will move to one more question from the room.
Can I add something? I think it's important to remember and recognize how Ebola is transmitted. It requires direct contact with blood and body fluids of an infected person. So it's not casual contact. It's not airborne. I think we need to be aware of that. And this relates to travel restrictions, which are not supported under the IHR recommendations. And we've heard about contact tracing and quarantine of those.
The Trump administration has confirmed that an American citizen tested positive for Ebola but will be treated in Germany instead of being brought back to the United States. Meanwhile, the CDC has also imposed travel restrictions on foreign nationals who recently traveled through Uganda, DR Congo and South Sudan amid the ongoing Ebola outbreak.
Ebola, yes, sir, Ebola.
Yeah. Should Americans be concerned about Ebola?
I'm concerned about everything, but certainly am. I think that, it's been confined right now to Africa, but it's something that has had a breakout. I could ask Bobby or Oz to say a couple of words about it, if you'd like. You want to do that?
I think Heidi Overton is going to come up and give us a few words here. Dr. Overton.
Thank you. Thank you, Mr. President. Today, the CDC held a press briefing that provided a lot of the answers and information, but we have stood up a full interagency response. The Department of State, the CDC, the Department of War, everyone is fully involved in tracking. Today, we do have an announced today at the press briefing. There is an American that is symptomatic and has tested positive for, it's the Bundibuja virus, a strain of Ebola. That American, as well as 6 other high-risk contacts, are going to be taken out of that region and taken to Germany. We want to thank our German counterparts. That is an internationally recognized location for viral hemorrhagic fever treatments. So we're very grateful that they would take them. It's a significantly shorter flight time for Americans to receive treatment there in Germany. For all other Americans, we have issued travel warnings. We have instituted just today entry restrictions for non-U.S. citizens that have been in the region in the past 21 days. So in Uganda, Democratic Republic of Congo, and South Sudan. So very serious measures that have been taken. We are working to communicate very frequently with everyone. Your question was, should Americans be worried? Right now, there are no cases of Ebola in America. We want to keep it that way, and we are doing everything we can to support Americans in the region. Thank you, Mr. President.
Well, now coming to India, the big question remains, has Ebola reached India? As of now, Indian authorities have confirmed that there are no reported or confirmed Ebola cases anywhere in India. But in response to the outbreak, India has also stepped up nationwide surveillance and airport screening protocols. Delhi's Indira Gandhi International Airport has issued a public advisory for travelers arriving from or transiting through high-risk countries such as the Democratic Republic of Congo, Uganda and South Sudan. Passengers have been instructed to immediately report symptoms including fever, vomiting, diarrhea, or also weakness, and also including sore throat, muscle pain, or even unexplained bleeding to airport health authorities before immigration clearance. The Union Health Ministry and Directorate General of Health Services have also conducted a high-level preparedness meeting with states and union territories. Hospitals have been asked to strengthen isolation, facilities infections control system, emergency response mechanisms, and lab readiness. With this, authorities have additionally increased monitoring at international airports and seaports, while integrated diseases surveillance program teams have been asked to remain vigilant for any suspected symptoms among international travelers. With regard to this, Dr. Rakesh Mishra, director of the Tata Institute for Genetics and Society, said that there is currently no approved therapy for this strain of the virus, making prevention the key priority remains. However, he added that Ebola does not spread like COVID-19. Meanwhile, a senior health ministry official clarified that India has reported no Ebola cases so far and the current risk remains minimal, though surveillance and preparedness measures are being strengthened as precaution.
About this Ebola virus, though no one yet, there is no case have been reported in India yet so far. But we can see that, the WHO has already declared a public emergency of international concern. What does it mean specifically if we talk about India, sir?
So this means that there's a new disease that spreads and has no treatment. So that's why it is a big problem. And actually for this strain of Ebola, there is no approved vaccine as well. Available vaccine may partially help. So anything infectious means a person traveling or in contact can bring the disease, and then it can that way spread in any country. So although risk for India is low, but it's not negligible, and we need to be concerned and very careful and watchful about it. As I said, because it's a infectious disease, so it can spread, and there is no treatment, and therefore it's a matter of concern. And finally, a very high mortality. It can be, on an average, are we seeing this strain 30% plus mortality, so it's very high. So these are the reasons to be concerned and careful and watchful.
Sir, what are the therapeutics which are available to treat the patient if a person acquired this kind of infection?
So there is no therapeutic for this virus. I mean, one can try symptomatic addressing and some antivirals that may partially work, but there is no approved therapy for this. That's why it's a matter of concern. But having said that, I think the focus should be more on prevention, because once person is infected, the chances of, severe clinical features are very, very high. But considering, unlike other very infectious viruses, this virus spreads only through direct body contact. That means through body fluid. It may be vomit, it may be any body fluid. So that is why the chances of this spreading like SARS-CoV-2 or something is not there. But wherever it is there, because of the physical contact or needle contamination and those sorts of things, and it can come in the system like through urine, fecal samples, and vomits and those things. So, and that way it can come into the chain, and some people may get infected. But if proper care is there, then it's a fairly manageable.
Those are the latest updates on the Ebola outbreak. So far, there are no reported cases in India, but precautions and measures are on high alert.